Thank you for all your leadership, Senator Bennett. The next two are Senator Lankford and Senator Brown.
Mr. Chairman, thank you. All of our witnesses, thanks for being here as well and talking through this important conversation. Dr. Benton, I do want to be able to start with you. Uh, for individuals within a school, whether it be a school counselor or a teacher that may discover some mental health challenges that a child would have, are there any barriers to communicating right now in the system, whether it be HIPAA issues or legal issues or just process issues with that individual communicating with parents, other school counselors or engagement, law enforcement, or outside medical entities? Are there barriers that are there that we need to be aware of?
Yeah, thank you, Senator Lankford, for that question. And I'll start my comments and defer to Dr. Huber, who has more expertise. But yes, there are barriers currently. So you're not able to have a conversation between a mental health clinician who actually may be caring for a youngster and his teacher or school counselors without permission, either through FERPA for the school and for HIPAA for the provider. And those two groups don't often communicate with each other, posing barriers for care. It creates a situation where for teachers and for counselors that addressing mental health concerns may require sending that young person off to an emergency department in order to get the care that they need. So yes, there are definitely barriers in communication related to privacy laws. Dr. Hoover, I didn't know if you had further comments.
Agreed. The good news is that many school systems, in partnership with behavioral health systems, have really navigated those HIPAA FERPA privacy issues. For example, by initially sending paperwork home to families, even at the start of school years, to inquire about whether they are willing to give consent for communication to occur when in the best interest of the child's health and well-being and academic success, allowing for some of that communication to occur, again, with privacy in mind, but also supporting academics. The other area that I would say is critical is really expanding data systems that allow for the seamless sharing of data between health and education sectors. And that has been done well in several districts and states. So there are good examples. It's just not widespread enough yet.
So are there needs that we need to have as far as change in statute to allow more of that communication to occur at this point? Or do you think the statute is appropriate? We just need additional permissions and access points?
It's a good question. I mean, frankly, I think that technical assistance and training and just raising awareness that HIPAA and FERPA do not have to be barriers to communication as long as you have family engagement and consent. That may be enough. It has been enough in several communities to actually bridge the divide here.
But I will say there are also state laws that govern who actually can release information. And so that also becomes a barrier because sometimes the young person actually has control over that information and the parents don't. And so, I think that in some places it works, but I think greater guidance and standardization of these processes would help all of the communities. Dr. Laborski, I know that this must come up for you often.
It does come up for us quite a bit, but I think the training involved, I think making sure that schools and the mental health providers. So when I think about our examples of where we're integrated in over 25 schools in our region providing mental health care, where we're delivering that for our staff, it's working collaboratively with the school, with the family system, parent, guardian, and caregiver to make sure everybody's involved. I think honestly, where we see this as a barrier, where it comes up as a challenge is when there's failure to communicate with the family system about the youth's need and making sure in advance of providing care or suggesting care that those conversations are happening as well. So I think that's where training is a big component.
Yeah, I would agree. In Oklahoma, we just had a law passed within our state that has allowed for training for everyone within the school on suicide prevention. We have 13,000 people in schools that have been trained just in the last couple of years just to be able to help with suicide prevention and to be able to know how to engage and the next steps on that. So in our state, we've been very forward leaning to be able to do what we can to be able to help. Mr. Chairman, a conversation that we could have at some point to be able to have on this whole issue as well is the whys and the prevention behind the scenes. We always, on the Finance Committee, we look at it and say, what can we do with more Medicare and Medicaid and what the tools that we have? The next big question behind it is, as we watch suicide rates rise 57% among teenagers and young adults over just the last 15 years, as we watch all these other things occur, to ask the practical question of why. Our nation has been through difficult challenges in the past, World War II, Great Depression, all these other things. Why are we watching some of the rise now? What's happening in technology? What's happening in the engagement? And for myself personally, I've worked with students 22 years before I came to Congress, working with middle school and high school students. This is an area I've worked with extensively, and I think there are a lot of questions that we've not asked the one behind the issue, not just how do we fix it, why are we seeing the rapid rise, and what do we need to be able to do? The issue of technology and telehealth is really important, but there's another angle with technology as well that's driving comparisons among individuals that's pretty toxic. And so we've got to be able to help resolve some of these issues in the days ahead as well.
Thank you, Senator Lankford.